for the young women that are diagnosed late. I come to you probably wearing 3 hats at least. I am a nurse, a public health career, health promotion specialist. I'm a young adult cancer advocate, particularly breast cancer in young women, and run a national charity in Canada called Team Shan, Breast Cancer Awareness for Young Women. We do have a poster on and I will share a little bit of information about that today as well. But probably most importantly, thank you very much. Most importantly, I'm also a mother, and this is my daughter Shanna. Friends and family called her Shan, and Shan lost her life to breast cancer at the age of 24, and it changed my career and my life at the time, and here I am today. When I started to investigate the work after Shan's death, the president of the Canadian Cancer Society at the time had this to say: if the incidence of cancer is very low in a sub-demographic group like young women with breast cancer, they are often misdiagnosed and ignored. And sadly, it's still happening today. And here's another quote I wanted to share, and this is from work done in Portugal. The increasing trend in the prevalence of breast cancer, we know it's increasing, associated with poor prognosis that we've already identified, more aggressive histologic features, and more frequent recurrence, makes it a rising threat to young women. We need to take action. There are a number of disparities. I think Alan mentioned a few, and I'll just try and elaborate a little bit. Later stage diagnosis than older women. And this is a lot of the work done by Rebecca Johnson in the US, and the amount of the young women, the disparity between the stage of diagnosis. Young women also experience more aggressive disease than older women, a higher risk of inflammatory breast cancer, and poorer prognosis than older women. There's also disparities even within the AYA cancer population. The higher incidence of AYA cancer in young women is related to breast cancer. The highest number of AYA cancer deaths and DALYs is related to breast cancer. And those are global concerns for sure. Young women with delayed diagnosis experience adverse outcomes, including distress and a lower chance of survival. And this is some more recent work done out of the UK around the distress related to breast cancer in young women, and also done in the US. And this is really upsetting because for years they've been saying, oh, let's not let young women know about breast cancer and be aware of breast cancer because it'll just be too hard on them and they will get anxious and not want to know whatever. And the thing is, not telling them is leading to late diagnosis, all the disparities we're talking about, and distress itself when they are finally diagnosed. It also can lead to a lack of confidence in their healthcare providers and the healthcare system when they are diagnosed late. And as Alan mentioned as well, we know that delayed diagnosis is due to patient or physician inaction. So both have to be addressed. The help-seeking barriers for young women, there's a variety of them. It's certainly multifactorial. Contextual barriers, including their ethnicity or their familiarity with someone who has had breast cancer. Developmental barriers, so incur sort of the invincibility of being young, but also the lack of awareness, and that's one that I'm going to highlight a little bit more today. And emotional barriers too, a lack of confidence, just being shy and not sure what to do about any of those feelings they're having around their health at a young age. And then there's practical barriers. There's too busy, work, school, and service barriers too. I don't have a doctor. I don't know where to go. I don't know how to access. But I'm going to focus on the developmental and emotional because this is what women are telling us. This is a recent report out of the UK. And young women it's a future me problem. I don't have to start mammography till I'm 40 or 50. It's a disease of older women. I don't have to worry about it. they have to understand that it's a disease of younger women as well. And I think we believe innately that if we're at medical risk, we should be told about it. So why isn't my doctor telling me about it? Why don't I learn about it in school health? All of these kinds of questions they were asking as healthy women that would like to know. And I don't know what I'm feeling for. How do I check? You already know that you should be doing it, but you don't know how to do it. And who's helping me to learn that? It's just not happening. We have sex education in the school. Why aren't we having further information about breast health? And other voices from young women. I just think it would be better for doctors not to turn around and tell you that you're too young, which is what they're saying. I speak to hundreds and thousands of young women, and it's the same thing. You know, I was told I was too young. So they need to be empowered to get past that too. And that they had a genuine concern. The guy who did the biopsy was like, almost seemed annoyed, and I didn't send there. They're often dismissed or feel dismissed. And he was really like, whatever, you know, don't waste my time. And certainly these are situations that Shanna ran into with the family physician. Cancer was not on the checklist, not on the radar, so her symptoms were just misdiagnosed as other things. But having said that, even when she tried to pursue, or even I tried to pursue, you know, she was just dismissed. What are you doing back here? You know, this, what do you want to expect me to do? You know, and then at the end, you know, they just couldn't believe it themselves. The awareness. What young women get breast cancer too. And with the Team Shan work we do in Canada, that's our first messaging. Young women get breast cancer too, or sometimes we use breast cancer, not just a disease of older women. They need to understand that they are in fact at risk, and then they're interested in learning more about it. And this is another thing too about sort of some of the myths out there that young women don't want to know. I speak to thousands of young women, and when we did our formal work across college and university campuses across the country, literally thousands of young women participated in our formal evaluations and thousands more informally, and we never ever had a negative response. They only asked for more, thanked us, wanted to be empowered. Knowledge is power. I just can't believe how we get stuck in some of these very negative myths around the disease. Young women need to understand their risks, know the symptoms, and the self-care strategies, including self-checks, because as we know, again, there's no regular routine screening for young women, and seek medical assessment. Self-detection is of paramount importance. One of our hashtags is check 'em, that we do on a regular basis to remind young women on social media. Awareness and education strategies to address knowledge gaps have also been met with some success. So, health promotion strategies, communication initiatives to reach young women, high school and physical health and education curriculum. And that's been published out of the UK, with certainly seeing some benefit for that, for raising awareness with young people. And we're trying to do more of that in bits and pockets. And I've done some work in Canada in this area too. And we're hoping to be able to do more. Tailored approaches to raise awareness and educate the AYA. Team Shan breast cancer awareness campaigns and health education targeting young women has been done across Canada. There was a decade when we could get prevention and early detection grants. And we were asked to do as many college and university campuses as we could. And we started in Ontario and went west all the way to British Columbia on our west coast, and did literally dozens of campaigns and marketing on the campuses. And I'll share some of those results. And also effective social media approaches too. Actually, one of the studies out of the University of British Columbia looked at using social media to increase young people's knowledge of the risk of tobacco and cancer. And it was quite successful. So for Team Shan, ours was a multifaceted approach on secondary campuses across our prairies and into Western Canada. The activities included billboards, public transit marketing, because young people take buses, young people take trams to go to school. And we also did campus media, campus displays, and presentations. Campaign print resources. I did bring a sample of our bookmark and our brochure for you to help yourself to dissemination, and also, of course, massive website and social media exposure. At the time, the theme we used was breast cancer, not just a disease of older women, and included Shan stories in the work. It was a multi-year study, and again, had a large number of young women participate in the post-campaign evaluations. And so that's our main billboard poster that we use, as well as for other posters. And what were the results? The vast majority, 90% or more, noticed the campaign advertisements. The most common take-home message was that women of all ages can get breast cancer, so they realized that they were at risk as well. And the breast cancer knowledge levels for for facts and for risk factors and symptoms of self-care, all the levels increased. And the vast majority started to take action or plan to take action. We didn't have the funding to do a long term to see how far that would go, but we were pleased to see they were starting already. And close to half the participants began sharing campaign information, and others intended to share the future they were sharing with friends and family and others that they were coming in contact with. Comments were incredibly positive, and this is a whole other thing, about being negative, and there was no negative comments ever received from our work we did, all positive, and they acknowledged the campaign importance to them and thanked us overwhelmingly for doing the work we're doing, and please keep it up, and please do more if you can. Shanna's story resonated with the young women and helped communicate the campaign messaging. Her face and her story became a critical part of the work. And this is just some of the feedback from the young women. It's a great thing you're doing to bring awareness that breast cancer can affect women of all ages. Amazing campaign. It is great to see a real situation with a real young, beautiful woman to make the situation more real and further awareness. I think this is a very important campaign, and I will be sure to spread the word. And just some of the discussion, that the campaign was successful in implementing a variety of awareness and education strategies. The young women understood that breast cancer can affect women of all ages, and the feedback was very positive. And so one of the unexpected results too, and it was a concern because Shan is a Caucasian with Scandinavian background. Interestingly enough, women from all rounds of ethnicity came to us and said, if she was a young woman and I'm a young woman, and this is very important, and keep doing it for all of us. Team Shan was successful in developing an effective health promotion strategy to reach thousands of young women on multiple post-secondary school campuses in Canada. And, of course, our objective was to increase early detection and improve outcomes for young women diagnosed. And this is the result of some of the work, and this is one of the girls that I've heard back from. There was one organization I think for my life, my early detection was due to Team Shan. And Amy shares her story for us, and she went in to see the doctor when she discovered her lump, and she went in because of seeing our marketing, our reminders on Facebook and whatever. And her doctor said, oh, you're too young, don't worry about it, you won't have breast cancer. And she said, wait, Shan was young as well, and Shan got breast cancer. And I tell the young women when I talk to them, in high schools and wherever I'm presenting, if the doctor isn't listening to you, don't be afraid to use Shan's story to say, I know young women can get breast cancer. We have to change that narrative so we have more Amy's. And then if we look at the issues for the healthcare providers, they too have barriers and challenges. And their knowledge gaps are around breast cancer in young women, especially around symptoms in young women and system challenges. And we also know that they need to understand the disease, similar to what we're hearing this morning, because it is different, how the symptoms, and then diagnostic and referral pathways. They need to consider cancer in young women presenting in their practice. And another hashtag that's being used is not too young, to try to get past that myth for sure. And this is a family physician that I worked with that was helping with some of our project work. What makes this disease so scary is that its victims are otherwise healthy young women in whom we least expect to find something seriously wrong. And they want to know more as well. I did a small survey with medical staff from Student Health Services on colleges and universities in the province of Ontario. And they certainly came back with, we need increased knowledge and resources for breast cancer in young women. And again, in New Zealand recently, they did a study with physicians, primary care providers, and that identified knowledge gaps, particularly around cancer symptoms and diagnostic pathways. And in the UK, they just finished an AYA cancer research priority piece. And one of the priorities that needed to be done was what general practitioners, awareness and education strategies they need to know to improve early diagnosis. So it's an issue happening and we're wanting to know more. Oops. Oh, I'm sorry. How do I get rid of that? I tried. Oh, there. Okay, good. All right. And yeah, so what can we do to help out? Well, first off, we need to get the message out there that young women get breast cancer too. Consider Cancer was actually part of the progress review group that the Lance Armstrong Foundation was involved with in the U.S. And it was very effective at putting an action plan in place for all the identified gaps called Closing the Gaps for AYA cancer. And this was their main theme around healthcare providers, that they need to, when a young woman is, or in this case, a young woman is coming into their practice with presenting symptoms, they need to consider cancer. And like I said with Shan, it wasn't on their radar. It wasn't on their checklist. There was no thought of cancer whatsoever. And this is over 20 years ago, and we still, we're still not doing this. Dr. Archie Blyer, too, put together a nice systems approach using the letters caution to help healthcare providers when they're coming in to sort of get a sense of, could this be breast cancer or could this be cancer? And we need to start using some of these tools for our healthcare providers. And resources and professional development opportunities need to be happening, and further education. Again, recent publication by Costa and others, various ideas, with community partnerships and other health promotion issues and education for family physicians and primary care providers. So I'm going to close with a quote from Desmond Tutu because I just love it because it's so health promotion related. But we need to stop pulling people out of the river. We need to go upstream and find out why they're falling in. And dear God, we need to go upstream. We need to be throwing lifeboats for these young women. We need to be getting public health at the table, looking at health promotion measures. Awareness and education matters. Early detection matters. Thank you.